Good afternoon, Queensland. And as we heard this morning, we only have one new case acquired in hotel quarantine, and we've had 7,538 tests in the past 24 hours, which is excellent news. Now, Dr Young will give an update about the Mercure Hotel and the Qatar airline flight, but all 8 people who had left the Mercure Hotel have been traced and isolated, so that's good. Great work from Queensland Health to have identified that. Well, we've got some good news for Queenslanders, and that is in relation to numbers at weddings and funerals. So it's been 58 days since we've had any community transmission in Queensland. So now we used to have the 200 for weddings and funerals. Now, if you have a larger space, you can have any number depending on that space. So that 1-2 square metre rule applies, and I know that's going to mean a lot, especially to our regional communities where there might be someone special from their community who's passed away, and a lot of people want to come and pay tribute. So that's great. And also too, we know that there are many people who have large weddings as well, and this is wonderful news for them. So that's very pleasing that we've been able to announce those easing of restrictions. So basically they're almost back to normal, which is wonderful news. Of course, we had a really good National Cabinet meeting today, and Queensland's doing a great job at the rollout of the vaccine. I want to thank Dr Young and, of course, the Department of Health, with health ministers been going around as well, visiting the sites, and we have now administered 6,534 across Queensland, which is wonderful. And I can announce plans to open up additional centres in Bundaberg and Logan, which will be administering the AstraZeneca vaccine. Now, that is contingent, of course, on the vaccine supply arriving. So it's due today or tomorrow. So we'll wait to see we've got that supply, and we're ready to go with Bundaberg and Logan. So it's a progressive rollout, and of course we're focusing on that 1A, which of course is our hotel quarantine workers and our frontline workers across those regions. So that's very good news. The other issue that we are focused on as well, we're seeing large numbers of COVID in Papua New Guinea, and I think everyone can appreciate to our wonderful brothers and sisters that live in the Torres Strait, we want to ensure that they are protected. And of course, I know I've stood on Borgu Island, where Papua New Guinea is within eye distance. So we want to make sure that our people living in the Torres Strait get the vaccine as quickly as possible. So we are now working with the Commonwealth, working through the Department of Health and the elders and the councils up in the Torres Strait, and the local member, Cynthia Louis, to ensure that we can administer that vaccine quickly because of the risk that people coming from Papua New Guinea over into the Torres Strait. And I'm quite sure that there'll be added patrols there as well. So that's wonderful news. So I might hand over to Dr Young, and then we can take a few quick questions. Thanks, Dr Young.
So one new case in Queensland overnight, which is another person from the Octedi mine. So we're seeing those increased numbers, which is not surprising given the spread of COVID-19 through Papua New Guinea. And we're just working that through. The management of the Octedi mine have been excellent, so that they've suspended their current charter flights, that they bring those miners back into Queensland so they can then go home. They're fly-in, fly-out workers from across Australia, and they're working over there in Papua New Guinea to work through how they can improve their processes in their mines to try and stop the spread. So that's really important. Now, we've managed to get hold of those 8 people who were in the Mercure Hotel on the same floor as that positive case that came back on that Qatar flight. So all of those have been contacted. So one of them was moved to another floor in the hotel, so is still there, so that's not a concern, of course. One of them went and returned home to Victoria, so we've worked with the Victorian health authorities. The other 6 are in Queensland, and so we're working through all of those and getting them tested. So that's very important, but that's all on track. And then of the other 74, so all of those have had one additional test. We're doing a further additional test, and then hopefully if there are no positives there, they'll all be able to leave quarantine on Monday morning as planned. So that's worked well. We haven't had any further cases, but I do have genome sequence results now back for the 5 people who are here in Queensland who came on that Qatar flight and have ended up positive, and all 5 genomes are exactly the same, so they're all clustered. We're still waiting on that advice from New Zealand, but unfortunately, of course, New Zealand's had their issues overnight, so we won't be pressing them. They've got more important things that they need to do at the moment. So, happy to take any questions?
Are the 5 the Russian strain there of the virus?
Yeah, they're all exactly the same, yes. So they all have that Russian variant. They're exactly the same virus between the 5 of them.
How's the investigation going into, say, the point of transmission? Is like the bus travel at all being considered as part of that? Or?
Well, we go for the most likely. So the most likely is it happened on the plane. So that's where they were together for the longest period of time. Yes, of course the bus is a possibility, but it's pretty remote. You think the amount of time they're on the bus, we've got our infection control processes in place, that I think that's very, very unlikely. And the other thing for everyone to remember is we're testing workers now every single shift, and we've not had a single positive worker over that whole time, and we're now, almost 2 weeks later. So I really don't think that's likely. Then similarly in the hotel, again, we're testing the workers there every single shift. I mean, they've been brilliant. They've allowed us to do this willingly, and they've cooperated, and the management of the hotel has been fantastic, and we've not seen it anywhere else. So it's most likely it occurred on the plane. It's just that coincidence, and it probably is just coincidence, that we had the 2 people next to each other in those rooms. So I'm just taking that very cautious approach of making sure that the other people who've been on that floor during that period just have some additional testing. So we've got the 8 who've already left, so we've found those, and then the other people who are still on that floor will have their normal testing. So really just being very cautious, because we don't want anything to derail our rollout of the vaccine. That's what we all need to concentrate on. That's what we need to do, and that's what's happening.
So there's no indication there's been any kind of breach of the health process?
No, absolutely none. Absolutely none. We know that this is even the usual variant. Right? This variant doesn't have any of those mutations of concern, but we know that we've had outbreaks in other hotels, not in Queensland, but in other states. So we know it can get out, and it's just a function of those corridors. So we know it's a possibility, but if you look at the balance of probabilities, it's most likely that it happened on the plane. But I am very grateful to those 8 people that are getting that additional test and are isolating themselves until they get a result.
Are you concerned about the border between PNG and the Torres Strait?
I am concerned about it, which is why we're rolling out the vaccine as fast as we possibly can up there. So I'm very grateful that the Commonwealth again has got us an excellent vaccine that we can use in the usual way, that doesn't have those storage requirements, because it would be very hard to take the Pfizer vaccine up to the Torres.
And those vaccines are coming in the next day or 2.
Yes.
Will they be going straight up to the Torres Strait?
They'll be coming into Brisbane, and then we'll work that through.
So it's being fast-tracked up there, essentially?
Yes, we are fast-tracking. I've had that discussion with the Commonwealth, and of course they're very, very supportive, and they're working that through with us.
And will that be for the phase 1A only, or will you
No,
bring in
no.
the 1B?
I'll be going through and doing the whole community on Boigu, Saibai and Bardu. They're the 3 islands that are closest to Papua New Guinea. So, of course, we'll do the healthcare workers and the border workers, but at the same time, we'll be talking to those communities, and we've started those discussions, that everyone in those communities, every adult, of course, 18 years and over, will be offering the vaccine to. Not mandatory, of course it isn't, but we'll strongly encourage them. And they are really good at getting vaccinated up there. They're always well and truly above the 95% target that we aim for children. So I expect that they'll take it up. We'll work with them about it.
Are you concerned at all about those 8 people in the community and being infectious and how long they're out of or not?
No, I think it's really important that we test them before we start getting concerned. As I say, I think that this individual got it on the plane. I do think it's unlikely, and the room was right next to it, so I'm not worried. It's totally different scenario to the last time when we had spread down a corridor. This is completely different.
Were all of those 8 people found in Queensland, or were they?
No, one went to Victoria, so the Victorian health authorities are working that through. One actually, so it's really 7 we're talking about, not 8, because one moved to another floor. So they're still there in the hotel. So it's really 7 people.
And Premier, just on National Cabinet, so obviously we're seeing an increase in cases coming in, and there's that risk of getting out through hotel quarantine as we've seen before. Was the Wellcome proposal discussed at National Cabinet, and Scott Morrison's said that still needs a more detailed costing proposal? What are your thoughts? Is this proposal dead in the water?
Look, I honestly believe it has merit, and really what we need to hear from the Commonwealth is, are they interested or not? It's a very simple question. Are you interested or not? John Wagner has provided all of the details of his proposal to the Commonwealth. We have had lengthy discussions at a departmental level. We need to know, are the Commonwealth interested or not? I mean, it's very fundamental. They are the people that have to allow the airlines to land into Wellcome. So it is a very basic 101 question. So it'd be nice to get an answer one way or not. We see the increase in Howard Springs, which I think is a great initiative. It's a great idea. But, we still are not going to see the full population vaccinated, I don't think, till the end of October. And, what we are seeing is, like, we had 7 people in hotel quarantine. That's the largest number we've had. So it is of some concern that we are still getting these different strains popping up in our hotels.
The Prime Minister's saying that he can't just, the Australian government can't just redirect commercial flights, that what they're doing with Howard Springs, for example.
Well, it just sounds like an excuse. It sounds like an excuse to me. I mean, if they can have charter flights going to Howard Springs, if they want charter flights to go into Wellcome, they can make it happen.
It's been more than a month since this idea was first floated.
Yeah.
Why do you think they won't support it in principle?
Well, I think they just need to say, are they interested or not? I mean, there's a lot of community support out there. I know people talk to me about it. It makes logical sense. If they want to bring more vulnerable Australians home, we have there's a proposal there by John Wagner working with the state government that can work with the Commonwealth government. It's got to be a two-way partnership. It's not one person said something and one person said another. You either want to work together collaboratively and get it to happen, or you don't. So I'm happy to have further conversations with the Prime Minister offline about it.
Has the Prime Minister given you any indication of when they'll give you an answer on it?
No. I said I'd have a chat to him offline about that.
Are there other options that that we have as alternatives to hotel quarantine?
Look, there's no other alternatives to hotel quarantine other than those charter flights coming into like Howard Springs and Wellcome. Yeah, but we're at a risky period now between now and the full vaccine rollout. So it's really important we get our quarantine workers done quickly, that the vaccine is progressively rolled out, and I think what you've seen here in Queensland and around Australia is everyone working together in terms of making sure that the people have the training. We're now getting the data from the Commonwealth. We're sharing that data. The Prime Minister's committed to giving out some weekly updates. I mean, this is all in the right direction. It's about making sure that the public is kept informed and updated.
Given the first is saying
they need more information, but Queensland is saying we've given it all. At what point could it just...
Well, no, that John Wagner has given all the information as well. I mean, you know, he's come up with the proposal for a 1,000-bed. I think it was reported in the Australian Financial Review today that he has given all of the information to the Commonwealth as well. So you're either going to, you know, set up a committee or a task force to get it done, or you're not. But I think the time has now come. We need a yes or a no. Are you interested? Yes. If you're not interested, well, that's a no.
And what do you say about the recent findings that allegations of misconduct were upheld by the state against the now Gold Coast Chief Executive?
Oh, sorry, say that again.
So there were recent findings of allegations of misconduct that were upheld by the State Department against the now new Chief
I don't have details on that. I'd have to get back to you on that one.
One of the councillors, though, says he wasn't aware of issues around David Edwards prior to voting to confirm him in that position. Is that legitimate? Like, should the local government minister investigate?
Look, I'm happy to refer that to the local government minister. But, you know, it's up to the body to make those inquiries or the person being interviewed to disclose that.
Will the government be introducing any new legislation next week?
We'll be updating everyone on that on Monday. We have a cabinet meeting Monday and a caucus meeting in the afternoon. So there should be some new legislation coming through.
In regards to the Torres Strait, have you boosted patrols up there during the day and night?
Look, I raised this at National Cabinet. It is a really serious issue. So, you know, we are committed to working with the Commonwealth between Border Force and our police service to ensure that whatever needs to happen, needs to happen. You just have to look at the proximity of Papua New Guinea, and I think also there are some agreements about ensuring that some vaccines are going into Papua New Guinea as well. So I think everyone wants to work together here, but you only have to look at a map, and maybe a lot of Queenslanders get out your map tonight and have a look. You know, Torres Strait, Papua New Guinea, it's only a matter of kilometres, and there's a lot of trade and commerce that usually happens, and we are seeing more and more cases, unfortunately, in Papua New Guinea. So we want to make sure we protect Torres Strait Islanders and far north Queensland.
And how many people would you expect to do on Saibai, Wadu and Badu?
I don't have those details, but we can get an update for you on Monday.
Are we sending people to PNG to help out with what's happening?
I thought we would.
We have in the past.
We have in the past, yeah.
Okay.
Yeah. Okay. Thanks, everyone. Thank you.